Hello and welcome to the NHS Project Futures Conference update. For those of you that couldn't make the conference, this is a brief summary of what was covered and some of the key elements that you might be interested in getting involved with going forward. So without further ado, I'll introduce myself. I'm Jo Stanford. I'm Head of Project Profession at Health Education England, and my team and I coordinated the day with key individuals from across the NHS. There were some key presentations. We had Fiona Spencer from the Infrastructure and Projects Authority come and talk about the government project profession and the development of that. Gina Naguib-Roberts came to talk about the development of the NHS People Plan and the role that project professionals can play in supporting delivery of that and the NHS long-term plan. I presented on the development of the project profession and the work to date around that. You'll see a little bit more about that in a minute. We talked about competence model that was presented for project management in the NHS. Looking at talent management systems and workforce data, existing and future regional PMO networks, Project Change Academy, learning environment in e-learning for healthcare, the healthcare governance and assurance responsibilities that NHS, Heather Chicken, who is Head of Profession at Department of Health and Social Care, is responsible for. We had the APM come and talk about corporate partner membership, which we've negotiated for the NHS as a whole, so each organisation can have the same membership benefits. And she came to talk about chartership as well and what a difference that's going to make to project professionals in the future. We talked about building capability and the future workforce through developing project management apprenticeships, a graduate programme, and putting project management into leadership academies, leadership programmes. We also talked about the NHS project profession implementation and operational delivery and how we would want to potentially take that forward. And we looked at then what would we call this and how we would manage it in future. So we're looking at it as the NHS Project Futures and what we can do to make that really make a sustainable change for the NHS in the next 5 years. So the rationale for a project profession, we did some analysis to look at existing data. And this is people working in roles that have project management type words in the title. And then we looked at the growth of project roles in track. And as you can see, a very conservative estimate is we currently have at least 7,000 people working in the NHS in project management type roles. So projects, programs, PMO, benefits, change, transformation, those kinds of roles. And also looking at the recruitment, that's nearly doubled in the last 6 years, and it appears to be a growth area. So that says that there's an appetite for it in the system. We looked at developing a vision, and if you want to spend a little more time on this, and the other slides for the conference are all in the Community of Practice site, which you'll see the link to later on. As well as having a vision for the profession, we have also worked on developing a Project and Change Academy framework, so things that we would consistently want to have in place. And the capability development element is the bit that we started with, but the professional pipeline is now starting to come through. We adopted and adapted a project capability model to look at the elements that we would want to have in place. And as part of that, we have also looked at adapting a competence model for the project profession, and this was discussed at the workshop, and we will do future work on it. This is an early draft and we would like to get more input into the development of this. There are some core competencies and there are also some specialist competencies linked to portfolio management, program management and organisational change management. How that will work in practice in terms of supporting people in their careers is linked to a programme that's going on at NHS Improvement that is part of the talent management programme, and that's linking professional information, professional registration and employment records into a single system, and this will be for all professionals within the NHS. and we had a demo of that, and this is now at the end of the discovery phase, and they're taking that forward and developing it further, and we want to be a part of that development for the project profession. We talked about rotational project management apprenticeships, regionally looking at supporting individuals with the opportunity to perhaps go on an apprenticeship and get experience in a frontline trust or a CCG or an arm's length body, and at the end have a much broader, well-rounded set of skills and competence. Linked to that, we talked about the graduate programme and the development of the increase in the number of graduates that the Leadership Academy is promoting, which we're working with them on. As part of that, we've developed some core skills modules, and this is for everybody. It's a basic level understanding of the various elements of programme and project management, because we know that most people in the NHS haven't got a background in this, and this would be useful for everybody as a starting point. There are 5 modules currently. You can see the link on the bottom of the slide. That will take you to e-learning for healthcare, where you'll find the modules in practice. And if you can, test them out and promote them with your colleagues and share them, that would be really helpful. So we have corporate partnership with the APM. We will send links out to everybody who is a head of professional, head of function in their organisation, so that they can access those resources. There are certain benefits that come with that that we will be promoting and making sure that people are connected to. We also talked about the development of regional PMO networks, and this is linked to the apprenticeships, to the APM membership, to support for secondments and other opportunities within the region and jobs, and looking at building that professional network within that geographical region. And Martin Sheridan came from the Northwest to talk about the PMO network that they run and to support other regions with the development of a network in their region. So he talked a bit about the challenges and opportunities of PMOs and the value of connecting them up across the system. We also talked about how the project profession could be managed, whether it sit potentially within a national body, or whether, like the Healthcare Financial Management Association, we have a separate association for project management that's not aligned to either a political or a national body, but is for professionals to be a part of. There was quite a lot of interest and appetite from the 100 or so people in the room from across NHS organisations across the country for the development of the profession. Not everybody was using the technology to vote, but hands in the room definitely supported the fact that there was support for the development of the project profession for individuals, but also the thought that it was supportive to the NHS as a whole and would really add value. We came away with some really good thoughts and feelings about the day and the next phase, and we talked about then the next step in terms of the 5-year plan for developing the project profession. So phase 1 was really initial research and early design and drafting of some of this. We're now at a stage where we want to go into the proper development in phase 2. And there are some work streams that bring those different elements of that programme together. And what we really want is for people from across the NHS working in this area, project professionals and programme and PMO professionals, to be a part of that working group. Along with the presentation, you may have a link to a questionnaire asking you what you would like to be involved with. We really need to get people involved to make it work and to embed it in the system. So that was a very quick whistle-stop tour. All of the presentations, all of the different individual presentations are all in the project delivery community in Knowledge Hub, and that link can be found on the email. And I just wanted to say thank you to everybody who made that day an incredibly engaging, positive and a progressive one, and we hope to see you, if you couldn't make this event, next time. Thank you very much.